Hello, and welcome to this academic taster session hosted by the Department of Sport and Exercise Sciences for our new MSc program in Physical Activity, Health, and Society. The way this session will work today is there'll be a brief introduction to the program overall, but then we'll dive into a mini lecture of about 10 minutes that will really give you a sense of some of the content that you might get to cover if you choose to come on this course, and to really give you a sense of what it would be like to be a student in the department. So before we begin today, I'd like to introduce myself. I'm Dr. Katie Sebastiano, and I'm the Director of Postgraduate Top Programs in the Department of Sport and Exercise Sciences. And so what this means is that I'm responsible for all of sort of the administration of our postgraduate top programs, which are MSc in Physical Activity, Health, and Society is, as well as sort of working with the students and being your key contact person about the information that you might need for this program. So any questions, concerns, either before as you're going through the application process or once you're a student on the program, I will be your key person within the department that you're able to contact about any questions that you might have. So by this stage in the process, I hope you're aware of the overarching program aims for our MSc in Physical Activity, Health, and Society. And this program truly is a multidisciplinary approach to studying physical activity and health and how they interact with inner society. We use different physiological, psychological, social, and political lenses to investigate this role, and we really hope to impact social and health inequalities, as well as how we can use physical activity to improve equity, as well as examining the role of physical activity in society in a variety of different ways. Now, when you come to study on the program, there'll be a number of core modules that you'll be expected to participate in, and you can see them here on the screen. Additionally, you'll have lots of options to choose, including research methods, both quantitative and qualitative, available to you, as well as a variety of other elective courses. But for the purpose of our mini lecture today, we're going to be focusing in on this core module here, which is our exercise as medicine and critical perspectives module. And so the overarching aims or outcomes for this module are to critically examine the practical need for physical activity intervention in specific populations while exploring the complexity of access, engagement, and sustained behavior change linked to physical activity programs. So what this means is that we'll sort of unpack how we can use exercise to improve outcomes for different individuals with a variety of physical conditions, but we'll also aim to build knowledge and critical understanding for the role of exercise as medicine and really investigate and analyze this role in specific populations. So really we're aiming to unpack this concept of what is exercise as medicine and how can we use this effectively, but what are the limitations that this paradigm comes up with. So the focus of our mini lecture today is going to be on exercise as medicine, critical perspectives, but specifically looking at cancer, aging, and physical activity. Now, the reason that I've picked this particular topic today is firstly because it is my area of expertise, and it's something that I will be covering in this module. So I am a clinical exercise physiologist, and I specifically investigate physical activity in cancer populations and how we can use it to improve outcomes throughout the treatment trajectory for these individuals. So what we're really going to impact today here is really the interaction between cancer, aging, as well as physical activity in these sort of brief 10-minute mini lecture that's going to be coming up next. So physical activity has been shown to have huge benefits throughout the cancer treatment trajectory. So the treatment trajectory means from someone being at risk of cancer all the way through diagnosis and treatment of cancer and into survivorship, so once they've finished their primary treatment. And there's a number of different ways that physical activity and exercise can be used to reduce the risk of cancer, improve outcomes for cancer treatment, as well as improve quality of life into survivorship. Now, this infographic that's on the screen here really demonstrates the many benefits that exercise can have during cancer treatment. So this is during primary treatment when someone is actively receiving their treatment for their cancer. And you can see here listed on the screen a variety of different things and different positive benefits that can have. A variety of things, including physical effects, as well as mental quality of life and well-being effects as well. So these are vast and varied effects and benefits for using exercise in this cancer population or cancer populations in general. So this sort of idea of exercise as medicine for cancer patients could be quite beneficial. to the fact that there are a number of different guidelines that have been published from a variety of different sources that suggest how much exercise a cancer survivor should be doing. You can see here listed on the screen a variety of different organizations that have published their exercise as guidelines for cancer populations, including Cancer Research UK, Macmillan Cancer Support, BASIS, there's the NICE guidelines, all within the UK that indicate how much physical activity an individual with cancer or going through cancer treatment can safely perform. Additionally, other countries have created their own guidelines as well. The Australian and American ones are listed on the screen, as well as the international consensus. So that means that all the experts who study physical activity in cancer populations got together and created what they think are the best practice guidelines for cancer patients throughout the world. So in order for this level of evidence to exist, and this number of guidelines to exist, that means that there is a lot of research in this area that suggests exercise is beneficial for cancer populations and a variety of different cancer populations. So that on a whole, the experts say, yes, it is beneficial. Yes, it is safe for individuals with cancer to participate in exercise, and this is how much they should be doing. Now, I want you to take a second and think. When I say a cancer patient to you, I want you to create a mental image in your mind as what that individual looks like. Think about their age, potentially their gender, and all those types of factors that you think when I say picture a cancer patient, what does that individual look like to you? So now take that image in your mind, and I want you to answer a second question for yourself as to who you think participates in cancer-related research studies. Is it that typical cancer patient that you would expect to see participate in those research studies? You would hope so, that when you think about what a typical cancer patient looks like, you hope that those individuals are the ones who are participating in research studies. However, this is not always the case. Now, age is the most significant risk factor for cancer. So as you get older, your risk of being diagnosed with cancer increases. This graph here has age at diagnosis on the x-axis and the number of diagnoses on the y-axis. And as you can see, as you get further right along the graph, so as you get older, the incidence of cancer increases exponentially. So this means that a typical cancer patient is an older adult. They're in their 60s, 70s, 80s, and beyond. However, when you look at the literature that looks at physical activity and cancer, it's disproportionately completed or studied in younger cancer patients. So there's this disconnect between those individuals who are regularly diagnosed with cancer and those who participate in these research studies. So it leads to this really important question as to why younger cancer patients are continuously included in these studies, these randomized control trials. What is preventing the older adults from being able to participate in these studies when they represent the greatest proportion of individuals being diagnosed with this cancer? Now, there are a variety of different barriers to participation, and they occur at a number of different levels. And in this mini lecture today, we won't have a chance to investigate these all in a lot of detail, but this gives you a sense of some of the things that might be preventing these individuals from being able to participate in these research studies. So the first level of barriers are the systematic barriers. So these are exclusion criteria, consent form, the language if it's not available in the language that they speak or are able to read, as well as the trial availability. So a systematic barrier is something that exists within the greater world that is preventing this individual from being able to participate in this type of program. And so those are things that the individual doesn't necessarily have a lot of control over, but it has to do with how the research is designed overall. And that's what's preventing these individuals from being able to participate. Additionally, care providers often prove a barrier or can potentially be a barrier for participation. There's often concerns about individuals experiencing toxicity from participating in the trial, concerned about that individual being too old to participate, as well as a perceived time burden in those individuals, or even within their clinic and they're being able to offer that participation in the trial, sometimes due to a lack of personnel, or they're not willing to participate in research or refer their patients for research studies. It could also be that they're simply unaware of trials that these individuals could potentially participate in, and as a result, the patient doesn't get referred to that trial. And so those are barriers that are also preventing the individual from being able to participate in it, but they're coming from outside that individual as well, and specifically from their care providers, such as their oncologists or supportive cancer care specialists. Now, the patient themselves also represent a lot of barriers to participation in these research studies as well. And sometimes these are broader societal things, such as being against experimentation or their personal preferences, but things such as their inability to access transport to participate in the research study are also important things that prevents them from being able to. Believing that they are too old to participate in these studies, or sort of the additional emotional burden that is placed on them by participating in these studies. So there are individual level factors that do influence who participates in these type of studies. Additionally, cancer patients often have a caregiver that supports them during their cancer journey, and these caregivers can also create barriers to participation in research, such as their preference to not participate, or sort of the additional burden that it might incur on that individual. And so this is potentially another thing that is limiting their participation in these studies. So the reasons that individuals are not participating, or that we don't have this representative data, is because of these multifactorial issues that all sort of culminating in older adults not regularly participating in this type of research. So do you think physical activity holds the same benefits for these older adults with cancer compared to the younger adults with cancer? And this is an important thing to sort of consider. Now, while most of the data has been done in these younger cancer patients, there is a small amount of evidence in these older cancer patients, and it's summarized by this slide here. And yes, exercise does have the same benefits for older adults with cancer compared to younger adults. Now, because there is such a smaller body of literature, there is maybe some not as strong connections that currently exist in the literature. The table on the right here sort of summarizes the beneficial effects, such as improved physical function, muscle strength, overall physical activity levels, as well as cognitive function, as well as some effects that have some outcomes that have had no effects, such as health-related quality of life, aerobic capacity, body composition, side effects and symptoms, as well as clinical outcomes. Now, this doesn't mean there isn't a relationship between these features and exercise in older adults. It just means that the evidence isn't there yet to support there being a relationship or a benefit for these populations. And that's because of the very limited amount of research in this area. If you look at this diagram here, what we can see in this systematic review that looked at physical activity interventions in older adults with cancer, we see very few studies made it all the way down to the bottom into being included in the study. And I think there's only 4 that are listed there that were included based on the inclusion criteria. So there is limited evidence, but it's limited positive evidence, which suggests that yes, it is beneficial for this population. So we need to figure out more ways to get older adults participating in these research studies and to have a more equitable distribution of research so we can better provide care for these individuals moving forwards. So that concludes our little mini lesson today. If you have any questions about the program or any of the content that I covered here today, please feel free to send me an email. I'm happy to answer any of your questions. And you can also visit our webpage here as well if you have any more general course-related questions. So thank you so much for your time today, and I hope to be able to talk to you soon.